Hello, my dear friends, and welcome. My name is Vickie Hadge, and this is Even So It Is Well. Tonight, I have a very special guest with me. Her name is Dr. Gretchen Hawley, and Dr. Gretchen is a physical therapist and multiple sclerosis certified specialist through the consortium of multiple sclerosis centers. She has a special interest in the management and wellness of MS patients, helping to improve balance, walking, and energy. She often presents as a keynote speaker at numerous MS events, and she collaborates with many organizations and foundations. She shares her expertise with MS support groups, podcasts, and on her YouTube channel and social media channels. Dr. Gretchen developed an online MS wellness program specifically geared towards helping people with MS in their own homes called the Missing Link, and I will put information in the description below. She uses social media to create more awareness around MS, neuroplasticity exercises that can help improve the quality of life for individuals living with MS worldwide. And I will put lots of links below to her website and her social media. Welcome, Dr. Gretchen.
Thank you so much for having me.
I'm really excited that you're here today. The topic of functional exercise versus regular exercise is one that's fascinated me. I was diagnosed a little over 4 years ago, and I know the importance of exercise. So can you begin with explaining the difference between functional exercise and regular exercise?
Yes, I love talking about this because it's a very important difference. And the one that's going to be best for you is dependent on what your goals are. One statement that I hear a lot that I think explains this perfectly is someone who has been exercising and they'll say, Dr. Gretchen, I'm getting stronger, but my walking still isn't any better. Or I'm getting stronger, but climbing stairs is still terribly challenging. And so the difference is that regular exercise will help improve your strength and your balance and mobility, but functional exercise is what will help you improve function. And often those are confused and people will assume, well, if I'm stronger, walking will be better, or if I have better balance, I won't fall over as much. But
Right.
it really isn't. There's two completely different forms of exercise.
Right. If you're looking to improve your function of walking and you're doing strength training, you're not practicing walking, right?
Right. And the thing is, too, is not only that, you're absolutely right in that you should be practicing walking, but even more than that, breaking down walking into all of the different movements that are required to walk. So when you think about walking, you need to be able to shift your body weight forward and backwards and side to side. You also need to be able to bend your knee and lift your toes up and bring your knee up towards the ceiling and straighten your knee and put your heel down. And all while that was happening on one leg, you were standing on one leg. So you
Right.
also need single leg balance. So that's what functional exercise is. It's picking a goal. In this case, what we're talking about, it's walking, and break it down into all those little mini movements required to walk. And those mini movements are now your exercises. And pick a position that you can do them in, whether that's standing or sitting or laying on your side or on your back. So you can modify and adapt it to you. But yeah, pick a goal, break it down. That's functional exercise.
Right. We don't think about walking and all those little goals and all those little movements side to side, left and right, lifting, moving, bending, straightening. And so the function of walking, when you break it down, there's a lot of different functions in there.
Absolutely. And that's true for any goal. Even another one that is common with my clients is standing up from any surface, even if it's a lower surface, as well as sitting down without plopping down and falling down. And if you go to a personal trainer or even a physical therapist, they are likely going to have you practice standing up and sitting down. But there's so much more, like even just to get into the position to stand up, you need to be able to move your legs out wider, which also requires flexibility. You need the ability to scoot forward and backwards. You need the ability to shift your body weight forward. So there's so many exercises that you can do just to help you get into the right position so that you can then stand up easier or sit down easier.
Right. You have to get prepared before you even start to move out of the chair or off the
Yeah.
surface. That's fascinating. So talk to me a little bit about how exercise in general can help us as MS patients.
Yeah, so exercise in general, no matter what that looks like, whether it's MS specific and functional or general, or if it's a class like swimming, yoga, tai chi, anything, any form of exercise and movement is good. It gets your muscles flexing, it gets your body moving, it gets your blood flow pumping a little bit better, your circulation. It actually can, if done in the right intensity, it actually can improve fatigue. It can improve mental clarity. It can improve depression. And so, whether some of these symptoms are a direct correlation to the MS or a side effect of one of the medications you're taking, or a side effect of just having MS for however long, exercise can help in all of those areas, not even to mention strength and balance and the more obvious ones.
Right, right. So I'm following the Overcoming MS program, which is a combination of diet, lifestyle, and medication. And that lifestyle part, if we don't move it, we're gonna lose it. And sometimes it's easy to say, oh, my foot's feeling kind of funny. Maybe I'll skip my walk today. But keep moving and keeping strong, I think, is really a big part of it. That's awesome.
Absolutely. And I try to
And
let my clients know too that, you can get caught up easily in feeling like, well, I've got to do my MS specific exercise or my functional
yeah,
exercise or whatever exercise. Like, I got to get to that. But you forget that general movement is exercise too. I'll never forget, I had a client that it was during COVID and her daughter got COVID.
oh
And
no.
so we had a call and she said, Dr. Gretchen, I'm so disappointed in myself. I haven't done any of the exercises that we talked about. My daughter has been so sick. She's staying upstairs. So I've had to, go up and down those stairs all day, bringing her food and tissues and all these things. And I stopped her and I was like, how many times do you think you went up and down the stairs? She's like, oh my gosh, I mean, at least 10, if not 20 times. And I had to remind her, that's exercise. Like, you did it way more exercise today than probably any other day. So it's
Right.
easy to forget that just things that we do throughout the day can also be exercise.
That's a great point. That's a great point. And back to the fatigue and the depression, and cognitive abilities with MS, fatigue and cog fog are the two leading reasons that people leave work that have an MS diagnosis. So if we can exercise and it's going to help our fatigue and our depression and our cog fog, more exercise for me, please.
Yes. And it's funny because a lot of people will say, how the heck am I supposed to exercise? I'm so fatigued.
Right.
Or, it
Yeah.
seems counterintuitive, which I can totally understand. But there's a lot of research showing that if you are doing light to moderate exercises and nothing over the top, truly just
Mhm.
movement. And some of my favorite examples are just sitting up tall in a chair and just punching your arms forward, just slowly and lightly, or even sitting in bed and doing
Yeah.
some forward reaches. There's so many light forms, and research shows that light to moderate forms of exercise can help with primary and secondary fatigue.
Excellent. So we don't have to go out and run a marathon every day.
Right.
So let's talk a little bit about how exercise can help our brains and neuroplasticity. How does that work?
Yes, I love talking about neuroplasticity because it is the main reason that someone with MS actually can get stronger and walk better and improve your balance. It's not just this wishful, hopeful thinking. Research shows that it actually can happen through neuroplasticity. So, neuroplasticity is the ability of our brain to either strengthen the neural pathways that already exist or create new pathways. So basically, what that means is I like to use the example of foot drop. So a lot of people with MS have foot drop or ankle weakness. So if you're the type of person that you have foot drop, and I will tell you, okay, put your feet on the ground and lift your toes up. Your heel stays down, but the rest of your foot comes up, and then lower it down. If you have no movement or very, very little movement, and maybe it feels heavy and hard to lift it, then when you practice with every repetition, your brain is going to try to find a different pathway to get from your brain all the way down to your ankle.
Yep.
And the idea is that eventually, and we don't know how long, it might take a couple of weeks, couple of months, couple of years, but eventually, the more you attempt that movement, the more opportunities your brain is trying to find a pathway. And then eventually your brain finds a pathway, and then it will continue to strengthen that. And then if you're on the other side of the spectrum where you're lifting your foot and you are able to lift it, but it is still challenging, then for you, your brain might be strengthening the pathway that already exists and is already working.
It is so amazing that we can build new pathways. When I was starting to research neuroplasticity, it was before my diagnosis, and a family member was looking into this to help with the problem they were having. And I just thought, so amazing that we have this reserve in our brains that we can make new pathways to use. So I just find that whole topic fascinating.
Oh my gosh, me too. And I think it's so encouraging because, at least for me, a lot of the people that I work with before we start working together, they feel like, oh, I can't lift my ankle, I'm just not going to do it. Or it's too hard to lift my leg, it literally doesn't move, I'm not going to do it. But what's important to understand is that even if you do have no movement or very little movement, or it's hard, wherever you fall on that spectrum, every repetition you do, your brain is trying to find a pathway that works or strengthen the one that's already there. So whether it moves or not, I tell my clients, movement is bonus. If there's movement, great. We're trying to find that neural pathway, which just takes practicing over and over and over and over and over again. So it does require resilience and perseverance because it can be discouraging, but just knowing that it's possible time after time can keep you in the game.
Practice makes perfect.
Yep.
Can you talk about what types of exercise that you feel is the most important?
Yeah, so I get that question a lot, and I have a few different answers. The first answer that I always say is the best exercise is whatever is aligned with your goals, because some people's goals are just simply to reduce fatigue, whereas others are more about walking and stair climbing, or someone else might be day-to-day things like getting into and out of the car, getting into and out of bed or the shower, or getting up and off of the ground. So it really depends. There's the best exercise or best exercise sets will completely depend on that. But one thing I can say that is true for everyone is cardio exercise has been shown in research to actually prime your brain for neuroplasticity.
Oh, that's awesome.
Yeah, not only is it amazing that neuroplasticity actually occurs, but if you do cardio before your functional and MS specific exercises, your brain is more likely to find a new pathway or strengthen the one that's already there. So cardio is definitely something that you can include. And high intensity interval training is another thing that's coming out in research over the last few years to be beneficial as well.
So when you say cardio, you don't mean we have to get our heart rates up for an hour. If we punch and we get our heart rates up before we do our MS functional exercises, that's going to help our brains.
Correct. Yeah. So, and I'm glad you mentioned that because when I say cardio, a lot of people think Stairmaster, elliptical, running, these typical things. But no, cardio can be one of my favorite things to do for cardio is when I'm just sitting up in my chair, I put my hands in light fists and I just pump my arms as fast as I can and keep going. And I try to go for like a full minute if possible. And then I let myself rest for just maybe 20 seconds and I do it again. So kind of interval training of just arm movements. And if you're moving quick enough, you will feel your heart rate rise. And another thing you can do to make it even more challenging is just simply talk as you're doing it. And that's going to be even harder. So your heart rate will go up. So yes, cardio can just be simply sitting in a chair or in bed. It doesn't mean getting up on your feet and going for a run.
Oh, that's awesome. So we talked a little bit about doing it from chairs and beds. Can you talk about any advice that you would give for people that have mobility aids and how they can do general movement and strengthening and cardio with their mobility aids?
Yeah. So, one thing with or without a mobility aid that you could do, I really like the mini exercise bikes. I think that's actually what they're called, but they might have a different name. Yeah, and they have the steppers too. Steppers you can actually put like under a desk or in front of a couch. I personally like the mini bikes, not the steppers, because you can hold on to them with your hands too.
Mhm.
And so you can bike forward or backwards. So if you're in a wheelchair, you can do it sitting in your wheelchair. If you
Yep.
have a walker, you can have your walker in front of you and you're standing at your countertop or at a
Mhm.
table where you're rowing forward and backwards with that. So that's something that I like to do for cardio. And the reason that I am a big advocate for arm-based cardio is so you don't fatigue your legs.
Mhm.
Because if you do cardio that does use your legs, you might be too fatigued where you then don't have good quality for your exercises. And quality is so important. And we can get into that a little bit later. But so I really like to use arms, but also keeping in mind that even doing something like sit to stands, so
Mhm.
standing up and sitting down and standing up and sitting down, that's also going to get your heart rate up. Or lifting some weights can get your heart rate up. So you can do those in a seated position or standing or even while
Mhm.
you're walking.
Excellent tips. So fatiguing the wrong muscle group. So if we're going to be working on our legs and our functional exercises for our legs, we should probably not fatigue them before we get started, and vice versa with our arms. If we're having, problems with, strength in our left arm, which I do, I should probably not fatigue that arm before I'm going to start strength training and functional exercise.
Yeah, absolutely. And it does take trial and error.
Mhm.
For some people, you can use your legs for your cardio and then have still enough extra oomph and strength in your legs to do your exercises, which great, that's a good option too. So or you might notice, oh my gosh, I was only able to get through one set of each of them because I got too tired too
Mhm.
fast. So it does take some trial and error in figuring out what's going to work best for you.
Right. So we're talking a little bit about functional exercise and sets and therapists. How can a physical therapist help us reach our goals? Why would we go see a physical therapist as opposed to just saying, oh, I'm going to do some crunches today and I'm going to do some squats? How can a physical therapist help an MS patient?
So many ways, but the best way and my favorite way that I'm able to help people is through the evaluation. So yes, you absolutely can just do exercises, whichever exercises you feel are appropriate. But when you go to see a physical therapist, we will break down everything about your movement. So if you have a goal of better walking, first of all, the way that I ask about goals is, when someone says, well, I want to walk better, I really push that a little bit deeper. And I say, well, what does that mean? Does that mean walking further or for a longer time or longer distance? Or just want to stand upright more instead of walking hunched over? Or is it your balance with walking? Or is it all of these things? Because there are different exercises for each of these things. So really getting nitpicky on what your goals are. And then, as I mentioned with the functional exercise, we're going to break down your movement. Like I'm going to look at your ankle, your knee, your hip, your core, your arm swing. And from that, we're able to really pick apart where your weakest areas are, where your
Mhm.
strongest areas are, and create an exercise program for you that will be even more effective.
Yeah, I think that's so important. Having the program that's specific to where you want to go, specific for your needs. Not just doing exercise, but having a program designed because we have a snowflake disease. We're all a little bit different. And having that evaluation and having the exercise program that fits what we want to accomplish is really important.
Yes. And I would say too, every PT is different.
Mhm.
So if you are going to a PT and they aren't asking you those questions, or they aren't concerned with your goals and they're just giving you general PT exercises, which is, I call it general PT, which is
Yes.
basically just orthopedic PT. Those are your exercises like clamshell and side lying leg raise
Mhm.
and straight leg raise and those types of exercises. Those are not specific to walking. I mean, I
Right.
could go off on a soapbox about this, but they're lying down. So those exercises are functional if you need to move around in bed more or do
Right.
something in a lying down position, but your brain doesn't have the same carryover. So the clamshell, yeah, it's great for your hips and you might have full strength in the clamshell lying down, but you go to stand up and that strength is non-existent. So again, with just doing the exercises in the right position. So what I was initially saying, if your PT isn't giving you MS specific exercises or functional exercise or really digging into what your goals are, shop around, see if there's a different PT, one who's going to listen a little bit better and actually work with you towards your goals.
Oh, I think that's such good advice. I think when we first are looking for a neurologist, we do the same thing. We need to find the neurologist that works well with us. And we can have a back and forth dialogue, and they listen to us and we listen to them. And it sounds like it's a lot the same with a physical therapist. You have to find one that will work with you.
Absolutely. And there are not a lot that are also MS specialists. There are some that are neuro certified specialists, so that's MCS, but the MS specialty is MSCS. So MS certified specialist. So if you can find one of those around you, that's the best option, because they're going to know the ins and outs of MS, not just physical therapy, but all things.
Right.
So that would be the best. With that said, because there's not many, you might not be able to find one. And in that case, the most important quality is that they're a good listener and that they aren't just going to give you a cookie cutter program.
Right. And I'm going to give Dr. Gretchen a plug here. She has the MSing link, and it is an online program, and you can work with her. And again, I'll put the link in the description below to her website, and you can check out her program.
Awesome. Thank you. Yeah. And the cool thing about, so as we're talking about right now, there's no cookie cutter program. Everyone with MS is different. And there's what I found in my years of working with people who have MS is that there were certain exercises that no matter when my clients were diagnosed or what type of MS they had or what mobility level they had, there were specific muscles that everyone had weakness in, whether it was a lot of weakness or a little bit of weakness, or there were specific positions that most people had balance difficulties with. So in my online program, that's where those exercises live. So it's all those exercises that no matter, even if I didn't know much about you, I'd probably give them to you. Just knowing as much as I know from my experience with working with people, there's certain muscle groups that are almost always affected that impair your walking or your balance or your function throughout the day. So those are all in that program.
Oh, that sounds awesome. Well, I really appreciate you joining me today. This has been so inspiring and so educational. Do you have any last bit of advice that you would like to share with the watchers on what they could do to help with physical therapy and help improve their exercise?
Yeah, I think my last thing I'd like to leave you with, and we touched on this today, but if there's one best thing that you can do, it's pick one goal. You probably have a ton, and that's great. I'm all for having goals in all areas of life, but pick one physical goal, and it might not be as easy as it is for me to break it down, but as best you can, break it down into as many movements as you can, or at the very least, do that thing that's hard for you to do as your exercise. So if standing up is hard for you to do, yes, you can break it down into a bunch of different movements, but simply practicing standing up and sitting down from a higher surface to make it easier is one of the best things you can do. Just practice the thing that's hard, but first make it easier. And you're almost for sure, I don't want to guarantee anything, but just by doing that, it's very likely that you'll start to notice improvements.
Awesome. Thank you so much again, Dr. Gretchen. It has been a pleasure to have you here today. Friends, thank you for joining me today. Please, if you like this video, give it a thumbs up, the like icon under the video. And if you have not subscribed yet, please hit the subscribe and the notification bell so you don't miss any upcoming videos.